Hold on. Just a second. Okay.
Good morning, Bucks County. This is Diane Marseglia, Bucks County Commissioner. I am here today with my fellow commissioners, as well as Dr. Damsker from our Health Department and Scott Forster from our Emergency Management Department. We're here to have a press conference today. We are doing it once again virtually. And I do want to explain, because I saw a lot of questions on Facebook from residents afterwards, we're only answering questions from the press. The press is sending them to a specific email address. We are going to try to think about doing a town hall type of thing in the future so that we can talk to the residents if they have questions. So we're not answering your questions. We just are answering press questions today. But thank you all for being here. And that's really what I wanted to start with today is gratitude. My gratitude for so many residents who are staying home right now. So many of you who are making sure that you stay 6 feet apart. It's so important. It's particularly important because you are, by keeping yourself safe, you are helping our workers at the hospital and our emergency management team and our rescue squads all be able to deliver the service they need to people who are truly sick. I also just wanted to throw out some gratitude to our health department. You may not know this, but besides Dr. Damsker, there are at least 35 people, I believe, answering phone calls all day long from residents. They're trying to triage people and move people to the next step. So they're all there supporting you. And in our emergency management office, we have 13 people on staff right now from all different divisions, making sure that all of your needs are being met. So that even though the county offices may not be operating, the county is open and able to help you. Also wanted to say, as a way of showing gratitude, we are encouraging everyone to clap to show that you care to all those first responders and the doctors and nurses at the hospital. 7 p.m. every night, just step outside your house or lean out the window and clap. And the last thing I just wanted to say to everybody is that there's been a little comments that I've been getting back and forth about the fact that the county parks are closed. And I just wanted to affirm that this is critically important. I know this is a very difficult time. I know those parks are very important to you. They're important to us. But if New York City can give up Central Park, we're going to be able to do without our county parks for a few more weeks. I encourage everybody, to go out in a yard if you have one. If you live in a condominium or an apartment, maybe share some space with people. But it's really important that we keep our parks closed right now and that we play our part in social distancing. So the next thing I wanted to do is introduce Commissioner Bob Harvey and see if he has a few things he'd like to say. Commissioner?
Thank you, Commissioner Marseglia. I want to echo Commissioner Marseglia's comments, thanking all those people who work for the county, who are coming to work every day because their jobs are essential, performing the functions that we need them to perform to help keep the county operating as it needs to operate in this time. I also want to thank everybody who's out there obeying the governor's orders, keeping 6 feet apart as much as possible, restricting their travel as much as they can. For some people who are able to financially afford to do things around the house, this is not the time to start that project that you've been looking to start for so long and just needed the time to do it. This isn't the time to go running to the hardware store to get something that you needed to start renovating your bathroom, and now that you have the time, you decide this is the time to do it. And especially if you have people that you want to call to your home because you need things done, plumbers, electricians, HVAC, this is the time to do that only if you really, really need it. If there's an emergency in your home, that's when you need to call the plumber and electrician. This isn't the time to start getting estimates on something you want to have done over the summer or to have a new ceiling fan installed, and you're putting their lives at risk as well. So we appreciate everybody who's abiding by the rules. We know it's difficult for all of us. And so we thank you very much. I want to just touch briefly on a few economic issues. We know that the state and federal government have passed different kinds of programs and policies that we know are going to be, we hope are going to be helpful to everybody. We are working with our 5 economic development and job development, workforce development agencies on how best to implement those plans. We do have a plan right now, a program launched through our redevelopment authority here in Bucks County that has been giving out some low interest loans. We had our Community and Economic Development Corporation working on state plans to help out businesses, and those are going to continue. And we did wanted to announce the tax deadline. A lot of people have been asking about the deadline for taxes. The deadline for the penalty, which would have kicked in on July 1st, has been moved to July 31st. We voted yesterday as commissioners. Wanted to announce the tax deadline. A lot of people have been asking about the looking to assist people as much as possible by pushing back that 10% tax deadline 30 days. So the discount period remains the same. It is still April 30th, but the penalty period has been pushed back. So we thank you again for everybody, and I'll turn it over to Commissioner DiGirolamo.
Thank you, Bob. Good morning, everyone. Gene DiGirolamo, good to be with you today. And I just want to start out. I mean, there's so many things in my mind that I'd like to say, but I just want to start out and say thank you to everybody, all the citizens and residents of Bucks County. I'm really, really proud of the way you have all reacted to these orders that have come out. I think for the most part, you are all doing a really, really terrific job. And there's one thing that happened this week that really jumped out at me. And, you know, we're just starting to get our hands, I think the medical community and the government, our hands around just how insidious this coronavirus is. And the one statistic that came out that said that at least 25% of the people who have coronavirus have no symptoms at all and are in no way do they know that they are possibly or potentially spreading it around in the community or to their family and friends. So I think knowing that, the most important thing that we can all do right now is follow the directions from the governor and stay home. That's the most important thing we can do. Stay home and limit the amount of time that we travel outside the house. Only go out of the house when it is absolutely necessary to get essential food or whatever, or medicine for your home. We've got to take this really seriously. I know we have, but I think we have to take it more seriously. There is no magic in getting away with this. We don't have a vaccine yet. Hopefully in the very near future that we might have a vaccine. But the most important message that I'd like to get out there to all the residents of Bucks County is please stay home. Don't go outside of your house unless you absolutely have to. And that'll help us cut down on the spread of this virus. And again, I am just incredibly impressed and incredibly thankful for all the people all across Bucks County that are working and helping this coronavirus and helping all of us. And that's our county employees, Dr. Damsker and Scott. Thank you very much for your hard work and service. I can assure the people of the county that we are working on this 24/7. Our healthcare workers, our police, our EMS, all the essential workers that are getting out there. Thank you for your help and your services. It's very, very much appreciated. So again, just a reminder and a message, stay home. We are going to get through this. We're going to get through all this together, but we've got to continue to work together. So thank you very much. And I'm going to turn it over to Dr. Damsker, I think, next.
Thank you, Commissioner DiGirolamo. As always, as everyone mentioned, we are continuing to work on this on a 7-day-a-week basis. We are still contacting every single confirmed case. We interview them to establish how they may have gotten coronavirus, who they may have given it to, where they work. We need to contact those locations to see if anything needs to be done from a infection control standpoint. And of course, we work with the patients, putting them into isolation and or quarantining it to others in the household as required. We do contact every single case. We still do that, even though we are continuing to get between 35 and 55 cases every single day. We seem to have sort of reached a equilibrium. I'm knocking on wood right now, but it looks like between 35 and 55 cases we're getting, depending on when the labs report to us. Sometimes we get a big laboratory dump of a bunch of cases they've gotten over the last couple of days, so that kind of skewed the numbers a little bit. What I can say though is, and I said this the other day, is that it's clearly we have over 400 cases as of right now, but clearly we have way more than that from our interviews with cases who have family, friends with very similar symptoms. So the number of cases in Bucks County is much higher than what we have confirmed. And I believe that's to be the case in every location, whether it's New York City or anywhere else. There's many more cases that are people that have mild illness that are not being counted. So everyone needs to take that into account with respect to the people in the community that they run across, with respect to the overall death rates and the fatality rates that you're hearing. Has lots of impacts on those kinds of things. We do have 10 people in Bucks County currently on ventilators that are confirmed cases, and we will continue updating the public on the numbers of those. We've had people come off ventilators. We've had between 50 and 60 people come off full isolation already, of people that are doing just fine out of our original cases. We do have more, we believe, but it's difficult to get to each person. We are contacting some of them every day. We're not hearing back from everybody, but we have instructed them on what to do to get off of isolation. And I'll say this one last time: the vast majority of our cases do have mild to moderate illness and are doing just fine. I want to make sure everyone's aware of that in Bucks County. And that includes the people that aren't even confirmed cases, but are people that we know that have symptoms like loss of taste and smell. That is clearly a coronavirus symptom that we're seeing in about 85% of all of our patients have that symptom, which is extremely, it's actually helpful, because if there are people out there that feel like they have a runny nose or a cough, some body aches, when they lose that taste of smell or taste, the sense of smell or taste, that is a pathognomonic symptom, which means it's pretty much guaranteed that you have it if you have that at this point. So I want everyone to be aware of the symptoms. And again, it's not always going to be fever, cough, shortness of breath. There's other minor general symptoms that people can have. You may feel like you're extremely tired. You may feel like you have some body aches. And sometimes that does obviously turn into more things like respiratory. But I want everyone to be clear that the initial symptoms, and they may be very mild. And I think that's, as Commissioner DiGirolamo says, they're talking about people that whether they're asymptomatic or mildly symptomatic, it's almost semantic, because if all you have is a minor headache and you're walking around, you may be spreading coronavirus. So I want to make sure everyone's clear that people in public, if you have to go out in public and you're not feeling well, there's current guidance coming out, and this may be addressed in the questions from the media, but the CDC is looking at whether or not people should be wearing masks all the time everywhere. And we're still waiting to hear on that from CDC. But I think it's important that if you are sick going out into public, you may want to consider wearing a mask to protect the people that you're interacting with in the public that do have to be there. So this is kind of an overall update on where we are today. I'd like to pass it over to Scott Forrester from Emergency Management if he has any additional comments.
Thank you, Dave. Good morning, everyone. I'd like to start off by saying the County Emergency Operations Center continues to operate as the county's nerve center for the resource request, the planning of the overall response to this situation, as well as information sharing with all of our community partners, including healthcare and public safety. We work in a great partnership with many county departments and a lot of folks at the health department. I want to say that we have a great team that is here. We are working on this as one single unit. I can assure the public that we communicate well with all of our constituents out in the community to ensure that the hospital's needs and the public safety's needs are met as well as we can. We have been recently able to acquire some personal protective equipment and other things that I spoke about yesterday. But we continue to work and support other facilities and hospitals with the request of ventilators and IV fluid pumps and all types of other things that they need, that we coordinate with the state and the Department of Health and PEMA. We are we've done a lot of planning for all types of things that could happen during this event. And even though we haven't put it in place yet, we have a lot of the ideas identified. We have ways to figure out how we're going to handle medical surge. We have ways that we figured out how we're going to do mass food distribution. We have worked together with the community partners and with the county agencies to try to identify all of the things that the citizens of the county would need as we go in these next couple weeks. As we move forward, we know that our case numbers will increase. We know that there'll be additional people that'll be hospitalized, and there'll be a greater need for public safety and healthcare workers. But we also know that with our planning efforts that we have done a couple of weeks ago and continue to do today, and the acquiring of as much resources as we can, we are putting the citizens of Bucks County in a good position to receive care while our public safety professionals and our healthcare workers are protecting themselves and preventing themselves from becoming ill or bringing it home to their families. So we will continue to work together. We will continue to build a community system where we will be able to respond to this. And every day, we get a little bit more prepared, but we'll have to see what happens over these next couple of weeks. But our relationships and our abilities and our planning efforts that we have done over the last several weeks are really putting us in a position where we'll be able to help the residents as this continues.
Thank you, everybody. And our Director of Public Information, Larry King, do we have any questions from the press?
Hi, Commissioner Marseglia, everybody out there. We do have a number of media questions, so I'll get right to it. The first is from Nikki Chacho of BucksCountyNewsFeed.com, and it's for the commissioners. She asks, has the Wolf administration given you any plan or indication of how the Bucks County business community is going to restart and recover post-COVID-19? And if there is none, when is Bucks County going to begin a ramp-up plan for non-essential businesses and workers?
Commissioner Harvey, do you want to take that?
Sure. We, as I said a little bit ago, we have been getting a steady stream of information from the governor's office regarding a wide variety of things, including about 2 weeks ago, I think it was, small business loans that were going out. That program has actually maxed out. It was a $61 million small business loan program that ended, I believe it was Tuesday night, because there were about $75 million worth of applications put in from all over the Commonwealth. As of right now, what we're really looking at is this, to wait for the federal program that was passed, for all of that information to sort of be digested and put out in a way that we can make use of it. And we've already started directing some information to businesses that have contacted us on the Bucks County website, buckscounty.org. On the COVID page, COVID-19 page, you'll find economic resources as one of the options. There is a 1-800 number that's available for people to call that actually has all kinds of information, but one of the options is for economic information. And there's actually, there's a person who's staffing that phone, who's fielding those calls and directing businesses to the proper agencies who can help them, giving them some guidance about programs that are available. There are even some employment options or opportunities for people. There are some places that are looking for workers and trying to find them. And so we're trying to connect those as well. That's really how we stand right now. And a lot of that has been geared toward getting us ready so that we can help these businesses over the next several weeks so that the ramp up is not nearly as severe as it could be, I guess.
Thank you, Commissioner. Nikki Chacho also has a question for Dr. Damsker, and that is, on March 28th, 2020, the FDA issued an emergency use authorization to allow hydroxychloroquine sulfate and chloroquine phosphate to be distributed and used for certain hospitalized patients with COVID-19. Has Bucks County used these treatments? And if not, do you have plans to?
There are some hospitals in Bucks County that have used it. Any results are, of course, anecdotal at this point, so I'm not going to comment on individual patients, but there are hospitals in Bucks County that are using those drugs, yes. And it's very difficult to know, whether the data can show that they're getting better or not, because there's certainly mixed results so far. But I think we need to wait a little longer to make any official determination as to the effectiveness of those treatments.
Okay. Next question is from Joe Chevalier of the Bucks County Courier-Times. What prompted health officials to test the 2 latest residents who died of coronavirus, but were not diagnosed with the illness before their deaths? Is the county testing all respiratory or pneumonia deaths for coronavirus? Also, were the latest 3 deaths residing in nursing homes or senior living communities?
Well, first, let me start off by saying that the 2 residents that she's referring to, they were tested while they were still alive, and the results came back posthumously. So it wasn't, so I hope that clears things up. They were tested while they were still alive with symptoms, and the results took us several days to come back, and they actually passed away before the results came back. So hopefully that clears that up. The second thing is there have been a couple of cases, and we're sort of leaving it up to any facilities to inform families that are in those facilities and or make it public. But at this time, we are not going to be making public those types of situations.
Okay, next question also for Dr. Damsker. This is from Jeff Bowen of lowerbucksnewssource.net. He asks, how many county residents have been tested to date? How many of those tests have come back negative? And on average, how many tests are performed daily?
Just to be, the quick answer is we don't know, because we don't get all the negative results. Our department is required to get the positive results. So as of now, we have 407 positive results. But if 100 people go to LabCorp today and get tested, we won't know that unless they become positive. So there may be state level data that can help with that, but we don't have that information as to how many people were tested versus how many people were negative. We're sort of swamped dealing with the ones that are positive, if that helps a little bit, but we don't have the exact numbers now.
Okay, Jeff also has a question about the county jails. He's asking whether there are any plans by the county to release nonviolent offenders due to space issues or challenges. What capacity levels are the jails at currently?
I can answer that a little bit. That's actually a great question to be able to ask the judges if you can, but we are not over capacity right now. We have no plan to just open up the jails and let people leave. I think they did try to get as many people who were trying to get bail and were able to make bail out, or people who were there on probation violations, and they were able to square that away. But we are not going to open the jails and let people out.
Okay, next question is from Jim Melwart of KYW News Radio. And he said, obviously, his question changes a little bit with yesterday's delivery of supplies that Scott Forster talked about. But he's still wondering, how do you make sure frontline workers are protected with very limited supplies? Isn't yesterday's delivery in the long run really a drop in the bucket?
So we do monitor the resources and supplies that healthcare facilities and public safety agencies use by looking at what we call a burn rate. How often are they using the supplies? And it really depends on how many patients they're exposed to that can show the symptoms of COVID-19, whether it be flu-like symptoms, whether it be febrile respiratory, whether it be cold-like symptoms, or any of the other symptoms that Dr. Damsker mentioned earlier. So we don't know that the amount of resources that we got yesterday will be enough or not, but I will tell you that we have about another 20,000 masks that are on order, as well as other supplies that will come in over the next 7 to 10 days. So we do have this wave of supplies that we've received, but we also have another wave of supplies that we have on order.
Okay, next question is from Aaron McCarthy of the Philadelphia Inquirer. Aaron says, late last week, county officials said they might be able to tell in a matter of days whether social distancing measures are working, in part by seeing how many new cases are individuals who also had family members or close friends who tested positive for the virus. Yet the county also said earlier in the week it was limiting contact tracing to healthcare workers, first responders, and people who work in nursing homes or jails, which is more in line with the community spread model. Can you explain this discrepancy, and have you in fact been able to gauge whether social distancing is working?
Yeah, I'll grab that. No, we haven't stopped contact tracing. I think there's maybe a misunderstanding here. We are focusing our major efforts on those first responders, long-term care facilities, hospitals, those kinds of things. But we are still contacting every single confirmed case and going through them where they may have gotten the virus, who they may be giving it to. We're just focusing some of our larger efforts on those other agencies that you mentioned. And what I can say is that we are definitely seeing a decrease in the numbers of people that don't know where the heck they got it. And that's partially, and the people that are getting it where they don't know, they're workers in hospitals, they're first responders, they're people who work at a store where there's people coming in and out all the time. So we are seeing the community spread that we're seeing is really only in the essential workers at this point. There's still a couple, one or two here and there, but the vast majority are those people that are still have to be out and about because of their job. And that's what we want to see. And we also, of course, as you mentioned in the question, we still have people that said, oh, my son came back from Barcelona and he gave it to this person, he gave it to that person, and we can still track back to where they likely got the infection. So when I say we're focusing our efforts on specific situations, we're still doing the contact tracing on every single case that we get. We haven't stopped doing that yet, if that makes sense.
Okay, Erin McCarthy also has another question. She said, do you have any updates on the number and locations of cases involving emergency responders, healthcare workers, or other frontline responders?
Yeah, we have several. We've had some law enforcement test positive. We've had some emergency medical services workers test positive. And that's sort of, we don't really know, especially since the ones that were infected the last couple, 2 weeks ago, we don't know where they got it. They could have gotten it from a patient. They could have gotten it from going to Giant. And I don't mean to single out Giant in a grocery store. I believe that, as long as this goes on, we're going to continue to see potentially some spread in those workers. I think anyone, if you're a logical person, you realize the people that are seeing sick people on a regular basis have a higher risk of getting sick. So I do believe we'll continue to see a few law enforcement, some emergency medical response teams, medical healthcare providers getting sick, but we also have a good system in place to get them tested as soon as we can, to get them back on the job or to rule them out if they don't have the disease.
Okay, next question is from Katie Meyer of WHYY, and she asks, I've seen some other suburban counties calling for more medical volunteers to help with COVID-19 containment efforts. Has Bucks been in need of volunteers? Have you gotten them? And do you expect that you'll need more?
We have a significant number of Medical Reserve Corps helping the health department right now, answering questions. We've had many, many thousands of calls coming in regularly. And we have some really good Medical Reserve Corps people that are helping us here at the health department. When it comes to healthcare, hospitals, we haven't received requests. Scott can speak to that. Does one of our local hospitals need additional help? If that's the case, the request can be made, and we can certainly talk to our Medical Reserve Corps about the providers that we have available there, and maybe assist in those ways. But we're certainly open to that. But we haven't had extreme need communicated to us yet for those people. But we're certainly open, and we're happy to help in any way we can.
Okay, a couple questions from Hayden Bittman of PBS 39. He'd like to know more about the medical equipment that was delivered yesterday. How will that be put to use? Where is it needed the most? I know big cities have said that they are running low on things like the N95 masks, but was that also the case here?
So that was the case here. There are many public safety agencies that have expressed their concern of the low amount of PPE that they had on hand, as well as some of our healthcare facilities. The stuff that we got in yesterday, we are in the process of dividing and sorting, and we're getting ready to distribute it. Our hope is that it will be distributed by the end of this week. There are 40,000 masks that came in together when you look at N95s and surgical masks and disposable surgical gowns and face shields and all those types of PPE. And we'll be getting some more in this week, but we're going to distribute those to our public safety workers, our long-term cares, and our hospital facilities that do need it, as well as other healthcare providers. We have mental health organizations, we have children and youth organizations, we have drug and alcohol supported organizations and groups that are going to receive this personal protective equipment, because it's not just the people in hospitals and doctors' offices that take care of the residents. We have to ensure that the whole medical community is protected to go out and take care of our citizens.
Okay, Hayden also has a question for the commissioners. He asks, I'm hearing some municipalities are staying shut down till April 30th at least. Is the county doing the same? I know everything is sort of fluid as we endure this crisis, but if there's any info, I'd love to know.
I'll jump in and say that we have not actually made a concrete decision on April 30th. I know that's, I believe, where the governor is, and that's where everybody's leaning, but we're sort of dealing with things in week and 2 week increments right now. I don't know if Gene or Bob has any thought on that.
Okay, and finally, Hayden has a question for Dr. Damsker. What's our outlook for April? Infection numbers seem to be continually rising. How is the county responding?
Yeah, clearly the infection rates are going to go up as people get tested. If you have a doctor's prescription, you can get tested in most locations. You know, the hospitals have things set up. You can send the specimens to LabCorp and Quest, even if the results don't come back as quickly as you want them to. But again, with the social distancing in place, we are seeing sort of a plateau right now with cases between, again, 30 and 50 cases or so per day. And I think we've sort of hit that plateau. And partially, again, is the advice that we're giving, and the other people are giving as well, that if you're not that sick, don't rush out to be tested. If you don't need to leave your house, if you're not feeling that badly, you're okay to self-manage with at home, drinking the liquids and the things we always talk about, and taking anti-fever meds. So from that case, we're sort of creating a plateau in some ways because we're not testing every single person in Bucks County. But I do believe that you're going to start to see a plateau. Social distancing is a real thing. People, you look at the streets, you look at the shopping store, even the stores that are open. There's clearly less people traveling. There's less people around. I see people wearing masks wherever I go. We're in a major. This is something we haven't really done in this country before. So I do believe once we get through this initial testing boom, I do think you'll see the numbers sort of start to plateau. They'll continue to go up because every day you get 50 cases, 30 cases, the numbers will go up. But I do believe the plateau will be occurring fairly soon because of the severe social distancing that we put in place.
Okay, question also for Dr. Damsker. This is from Kara Seymour of Patch. She said, officials in Montgomery County yesterday estimated the virus's peak is 2 weeks away there. Do officials in Bucks County believe the same is true here? And if not, when is the local peak anticipated?
I don't think anybody knows for sure. I mean, I think that's an educated guess on their part. I think all of this is an educated guess. And I sort of answered that question a minute ago, but I'll confirm it. If we start to see 30 to 50 cases every day going forward, you'll start to see the number of cases will be going up, but at the same rate. And until we stop testing people, or until we stop having people going out in the public doing the essential jobs we talk about, we're not going to completely eradicate the disease. But I do think it's reasonable to say that given the social distancing in place, that we should start to see it fairly soon. I don't know whether 2 weeks is an exact number. Clearly it's not, but I am getting optimistic that because we're not seeing random community spread, as I mentioned a few minutes ago. So I'm hoping that the cases will be only in those essential people having to leave their homes, as well as those people potentially infecting, family members.
Okay, question from Tom Sofield of Levittown Now for Dr. Damsker. How does Bucks County stand in terms of hospital capacity?
There's still there's several hundred hospital beds available, dozens of ICU beds available in Bucks County. So I think the hospitals are busy. I think that they've seen an increase for sure. I think they're planning on opening up certain things like having a special COVID-19 wing where they can cohort patients together so they can use the same PPE for all the patients. Everyone going in that unit is a COVID positive or COVID suspect. So I think the hospitals have done a really good job sort of navigating the future, saying, hey, we may have a lot of COVID patients. So they're very busy, but I don't think they're overwhelmed yet. And I think that if they continue thinking like that, we talk with them every week or more than that to go through what everyone's doing. I think all of our hospitals are putting together plans that would allow them to increase the beds if they need to. But having a sort of a COVID wing, and several of the hospitals have done that, I think it's a really good idea. And I think you'll start to see, hopefully this doesn't happen too often, but even some of the nursing home facilities in Bucks County will start to do the same things and cohorting people together that are sick. And that helps with the spread and helps, with the bed utilization.
Okay, follow-up question on supplies for Scott from Jim Melward of KYW. How competitive is it to acquire those supplies?
It's been very competitive. The County Emergency Operations Center has logistics staff that their responsibility is just supplies and equipment, as well as other things to acquire to support the response to the pandemic. But we also have the purchasing department here in the Emergency Operations Center, and we have called dozens of vendors looking for supplies. And some of the vendors that we actually were able to purchase things from, they delayed our order and then several days later canceled our order. So it has been very difficult to acquire the stuff that we have been able to purchase. And it's been very difficult to actually get pieces of the strategic national stockpile because it's very competitive across the entire nation for all of the supplies that are not only being produced in warehouse, but a lot of it is being imported from outside of the United States.
This looks like it might be our last question. It's from Teresa Nazario of CBS 3. What is the current case total in Bucks County?
As of this minute, as of 11:35, we have 407 cases. By the time I'm done this answer, we may have 408. But we do receive cases throughout the day. And again, the laboratories sort of dump them a lot of times at one time. So we may get 20 cases at once from LabCorp, 10 from a different one, 5 from a different one. So, but that's what we have now. But I will tell you once again that we probably have many times that, based on our contact tracing interviews with families and friends and those of the cases.
Okay, I think that's all the questions we have. My phone was just ringing, but I couldn't get that one. So I'm going to turn it back over to Commissioner Marseglia.
Just to thank everybody for being here today and listening to all of us. I want to remind everyone that the best way you can volunteer for the community right now and the most selfless thing you can do is to stay home, stay safe, and stay 6 feet apart. Thank you.